Is bone cancer curable? This is a question that most people who suffer from it have in common. Bone cancer is a rare disease, but causes a lot of anxiety for patients and their families. With the continuous development of modern medicine, the answer is not only hopeful, but also a testament to the power of science. When bone cancer, if detected early and treated promptly, can be cured, or life expectancy can be significantly prolonged. First, we need to understand what bone cancer is. Bone cancer is the abnormal growth of cells in the bones, leading to the formation of malignant tumors. This disease can occur anywhere in the body, but is most common in long bones such as the arms and legs. Classification of bone cancer. Bone cancer is divided into two main types. Primary bone cancer, originating from the bone cells themselves, cartilage tissue or soft tissue. Common forms include osteosarcoma, chondrosarcoma, and Ewing sarcoma. Secondary bone cancer results from metastasis from cancer in other organs, such as the lungs, liver, or breast. Why is bone cancer especially dangerous? Tumors in the bone not only weaken the bone structure, but also easily metastasize to other organs. Once the cancer has spread, treatment becomes more complicated and less effective. Who is at high risk? Bone cancer often occurs in two main age groups. Adolescents, 10 to 20 years old. This is the stage when the body grows rapidly, making bone cells vulnerable. Older adults, over 50 years old, due to bone degeneration, especially in people with pre-existing bone disease. Can bone cancer be cured? This question is a major concern for most patients and their families. The good news is that bone cancer can be cured if detected early and treated promptly. Factors affecting the ability to cure. Stage of detection. In the early stages, cancer is limited to the bone and has not metastasized. The chance of cure is up to 80 to 90%. When cancer spreads, stage 4, the goal of treatment is usually to control symptoms and prolong life. Types of bone cancer. Osteosarcoma. Responds well to surgery and chemotherapy. Ewing sarcoma requires multimodal treatment, including surgery, chemotherapy, and radiation. Chondrosarcoma. Often more difficult to treat due to resistance to chemotherapy and radiation. General health of the patient. Patients with good resistance often tolerate strong treatments, such as chemotherapy or radiation. Treatment method. Multimodal treatment, combining multiple methods, is the key to increasing the chance of cure. Symptoms of bone cancer. Bone cancer is often difficult to detect early because the initial symptoms are vague and easily confused with common bone and joint problems. Early stage symptoms. Bone pain, dull pain, increased at night or with vigorous exercise. Swelling or lump appears in the affected area. Feeling hot. The skin in the cancerous area is often warmer, with blue-purple blood vessels. Advanced stage symptoms. Prolonged pain, does not subside even with pain medication. Weight loss and fatigue, accompanied by a low-grade fever of unknown origin. Weak, brittle bones, even a slight impact can cause a fracture. Symptoms of metastasis. If the cancer spreads to the lungs, the patient may have difficulty breathing or cough up blood. Causes and risk factors. Causes of bone cancer. Although the specific cause is unknown, some factors may be associated with the risk of developing the disease. Genetics, gene mutations in people with Lee-Fraumeni syndrome or retinoblastoma. Radiation exposure. People who have had radiation therapy or lived near a nuclear accident. Bone diseases, such as Paget's disease of bone or repetitive trauma. Risk factors. Age. Adolescents and the elderly are the highest risk group. Gender. Men are at higher risk of developing bone cancer than women. Family history. If someone in the family has cancer, the genetic risk will be higher. Diagnostic methods. To diagnose bone cancer, doctors will apply a combination of methods to assess the severity of the disease and plan appropriate treatment. Imaging, X-ray, determines the location and size of the tumor. CT, computerized tomography, assesses the tumor's damage and spread in more detail. MRI, magnetic resonance. Imaging, observes the tumor's invasion into soft tissues and nerves. PET-CT, Look for metastatic cancer cells in the body. Biopsy takes a tissue sample from the tumor to determine the type of cancer and the degree of malignancy. Blood tests evaluates related indicators such as calcium, alkaline phosphatase, and cancer markers. Top treatments. Bone cancer is a complex disease that requires the coordination of many specialties to achieve the best treatment results. Leading treatments. Currently, the main treatments include surgery, chemotherapy, radiotherapy, and multimodality therapy. Each method has a different role and application depending on the type of cancer, the stage of the disease, and the patient's health status. 1. Surgery. Surgery is the main treatment method in most cases of bone cancer. The goal of surgery is to completely remove the tumor, along with a part of the surrounding bone or tissue to ensure that no cancer cells remain. Types of surgery in the treatment of bone cancer. Limb-sparing surgery. This is the current preferred method to help patients retain the damaged limb, maintain motor function and aesthetics. In this surgery, doctors will remove the tumor in the affected bone, then replace it with artificial bone, made from titanium alloy or biomedical materials. Allogeneic bone, bone donated from a donor. Autologous bone graft, bone taken from another part of the patient's body. Amputation surgery, indicated when the tumor is too large, located in a complex position, or when the limb cannot be preserved. After surgery, the patient may be fitted with a prosthetic limb to restore motor function. Reconstructive surgery after amputation, when the bone or joint is removed. Advantages of surgery, effective in removing cancer cells, reducing the risk of local recurrence. Challenges in surgery, risk of not removing all cancer cells leading to recurrence. Post-operative complications such as infection, blood loss, or nerve damage. After surgery, the patient needs to undergo physical therapy to regain mobility, psychological counseling, support patients in adapting to physical and psychological changes after surgery. Second, chemotherapy. Chemotherapy is a method of using strong drugs to destroy cancer cells. This is a systemic treatment, meaning that the drug not only affects the cancer site, but also the entire body, helping to control the spread of the disease. The role of chemotherapy in bone cancer. Chemotherapy before surgery shrinks the size of the tumor, making surgery easier. Controls cancer cells that have begun to spread but have not yet formed large lesions. Chemotherapy after surgery destroys cancer cells remaining after surgery, prevents cancer from recurring. Palliative chemotherapy, for patients who cannot be completely cured, helps control symptoms and improve quality of life. Common chemotherapy drugs. Doxorubicin attacks the DNA of cancer cells, making them unable to replicate. Cisplatin causes DNA damage, effectively destroying cancer cells. Methotrexate inhibits the growth of cancer cells. Efosfamide and etoposide, often combined to increase the effectiveness of treatment. Side effects of chemotherapy: fatigue, nausea, loss of appetite, temporary hair loss, weakened immune system, increased risk of infection, bone marrow damage causing anemia or thrombocytopenia. 3. Radiation therapy. Radiation therapy uses high-energy rays, such as X-rays or protons, to kill cancer cells. However, not all types of bone cancer respond well to radiation therapy. When is radiation therapy used? Combined with chemotherapy, especially effective in treating Ewing sarcoma. Adjuvant treatment after surgery, remove remaining cancer cells. Palliative treatment, relieve pain and control symptoms in patients with advanced cancer. Types of radiation therapy. External radiation therapy, using a machine that emits radiation outside the body. Internal radiation therapy, introducing radioactive substances into the body placed near the tumor. Advantages: minimally invasive, no surgery required. Reduces pain symptoms quickly. Disadvantages: can cause damage to healthy tissue around the tumor. Side effects such as fatigue, dermatitis in the irradiated area. 4. Multimodal treatment. This is a method that combines many therapies such as surgery, chemotherapy, and radiation therapy to achieve optimal treatment results. Benefits of multimodal treatment. Increases the ability to completely eliminate cancer cells. Reduces the risk of local recurrence and distant metastasis. Challenges of multimodal treatment requires close coordination between specialists. Long treatment time, requiring patience from patients. 5. Other supportive methods. Immunotherapy, boosting the immune system to destroy cancer cells. Immunotherapy drugs are being studied, such as PD-1 or PD-L1 inhibitors. Pain relief, using pain relievers such as morphine in cases of late-stage cancer. Psychological support. Psychological counseling helps patients cope with feelings of anxiety and fear. Bone cancer is not the end. With the advancement of medicine, this disease can be completely treated if detected early. Stay strong, follow the treatment regimen, and have regular health checkups to protect yourself and your family. Don't forget to share this article if you find it useful.